Part A. Extract 1. Questions 1 to 12. You hear an endocrinologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I understand you're here today to discuss some concerns. Why don't you start by telling me what's been going on?
Thank you, doctor. Well, I've been feeling off for quite some time now, and I'm not sure what it is. It's difficult to explain. About a year ago, I started noticing small changes, like my hands and feet swelling up, but I thought it was just normal, maybe from working too much or standing for too long. Then, about 6 months ago, I noticed my face looked different. My jaw seems more prominent, and my nose, I'm sure it's bigger than it used to be. Even my rings don't fit anymore, and I've had to buy larger shoes. It feels odd, like my body is growing, but not in the right places.
That must be quite distressing. And Mihira, these changes have been gradual, you say?
Yes. That's what's strange. It's not all at once, but slow, like everything's expanding bit by bit. But it's not just physical, doctor. I've also been having terrible headaches. Sometimes they're so severe that it feels like a pressure behind the eyes. I've also been feeling extremely tired lately. Even simple tasks, like walking up the stairs, leave me breathless. And there's another thing, I feel like my skin is thicker. Does that make sense? It's become tougher and oilier. I can't seem to figure it out.
Have you noticed any other symptoms?
Yes, I've been having problems with my vision. It's like a tunnel. I can't always see things at the edge of my sight, especially when I'm driving or reading. My peripheral vision is just not the same. As for the joint pain, well, yes. My knees and elbows feel stiff, especially in the mornings. It takes a while before they feel normal again. Sometimes I think it's arthritis, but it feels deeper, almost as if my bones ache. Also, my voice, it's deeper now. My friends joke that I sound like my brother, but I don't think it's funny. And my tongue, it's bigger. I've bitten it a few times while eating.
I see. Could you describe how these symptoms impact your routine?
Oh, it's awful. I used to be so active, I loved going for walks and doing yoga, but now I'm too tired all the time. My job as a teacher has also become more challenging. I can't keep up with the energy of my students anymore. I get exhausted just standing in front of the classroom. Sometimes I have to sit down during lessons because my legs feel so heavy. And with the vision problems, I've even had a few close calls while driving. I'm scared to drive at night now. Not to mention the headaches, they come at the worst times, making it hard to concentrate.
That sounds incredibly frustrating. Mihira, have you tried any treatments or remedies for these symptoms before coming to see me?
Well, I saw my general practitioner first. They thought it might be stress-related, so I was prescribed painkillers for the headaches, paracetamol and ibuprofen, but they didn't help much. I've also been on some anti-inflammatory medication for the joint pain, but it hasn't made a huge difference either. I even tried some home remedies like massages, hoping they might relieve the swelling, but nothing seems to work. At one point, I thought it could be hormonal, so I tried changing my diet, cutting out sugar and caffeine, but still, no improvement. I feel like I'm just getting worse.
All right. Based on what you've told me and the range of symptoms you're experiencing, Mihira, it's possible that we're dealing with a hormonal condition. Specifically, I'm concerned that you may have a condition called acromegaly. We'll start with a serum IGF-1 test, which measures the levels of insulin-like growth factor 1. Elevated levels are often associated with excess growth hormone.
That sounds like a lot, but I suppose it's necessary, right?
Extract 2. Questions 13 to 24. You hear an oncologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good afternoon, Mihira. Please come in. How can I help you today?
Thank you, doctor. I'm here because I've had persistent pain around my throat and neck for the past couple of months, and it doesn't seem to go away. I also noticed some swelling under my jaw, and I feel like my voice is changing. It's become hoarser over time. I've also been feeling quite fatigued.
I see. It's important that we look into these symptoms, especially since they've persisted for some time. Mihira, have you tried any treatments for these symptoms so far?
Yes, I've tried a few things. My general practitioner prescribed ibuprofen for the pain, but it only helps temporarily. I was also given some antibiotics in case it was an infection, but those didn't seem to make much of a difference either. I've tried some Ayurvedic remedies as well, but nothing has really improved.
Alright, it sounds like those treatments have been more about managing symptoms rather than addressing the underlying issue. Could you also tell me a bit about your medical history?
Yes, about 5 years ago, I had surgery to remove a benign cyst in my neck. My GP mentioned that I have slightly elevated blood pressure, but nothing too serious. Other than that, I've had some issues with recurring tonsillitis in the past. I've never had anything as persistent as this before.
Thank you for sharing that. Based on what you've told me, we're looking at some concerning symptoms in the head and neck region, and given your history and the duration of these symptoms, we need to conduct some imaging tests, including an ultrasound of the neck and a CT scan to check for any abnormalities. We'll also perform a biopsy of the swollen area, just to be thorough.
Does that mean you think it could be cancer?
At this point, we can't say for sure, but Mihira, it's important to rule out all possibilities. The biopsy will help us determine if there are any malignant cells. Now, based on what we've seen so far, it's possible that you could be in the early stages of head and neck cancer, which is still treatable. I want you to understand that even if it is cancer, early detection improves the outcome significantly. We'll take it one step at a time.
I see. What happens if it turns out to be cancer? What's the treatment plan in that case?
If the diagnosis is confirmed, and it's the first stage of head and neck cancer, we'd most likely start with a combination of treatments. The main options are surgery, radiotherapy, and possibly chemotherapy, depending on how aggressive the tumor is.
How long would the treatment take? And what about the risks?
The treatment duration can vary. The process can take several months. Surgery would require a few weeks for recovery, and if we follow up with radiation therapy, that could last for about 6 to 7 weeks, with daily sessions. In terms of risks, surgery carries some general risks, such as infection or nerve damage, especially because we're dealing with a sensitive area like the neck.
I just want to make sure I'm doing everything I can to get better.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a doctor called Mihira talking to a nurse. Now read the question.
Nurse Lewis, I think it would be beneficial to conduct an educational program for parents on common childhood illnesses.
That's a great idea, Dr. Mihira. Many parents may have questions or concerns about their children's health.
We can cover topics such as common childhood infections, vaccinations, and when to seek medical attention. We can also provide information on healthy eating, exercise, and sleep habits.
How can we reach a wider audience?
We can distribute flyers and posters throughout the community. We can also collaborate with local schools and community centers to promote the program.
What format should the program take, Dr. Mihira?
We could offer a series of workshops or presentations on different topics related to child health. We could also provide handouts and resources for parents to refer to after the program.
Now look at question 26. You hear a pharmacist called Mihira talking to a patient. Now read the question.
Hello, Mr. Peter. How can I help you today?
I have a prescription for an inhaler, but I'm not sure how to use it properly.
I'm happy to help you. Can you tell me what type of inhaler it is?
It's a meter-dose inhaler, MDI.
Great. MDIs are commonly used to deliver medication directly to the lungs. Before using the inhaler, shake it well to ensure the medication is evenly dispersed.
Okay, Mihira, I'll do that. What else do I need to know?
It's important to use a spacer with an MDI. A spacer helps deliver the medication more effectively to your lungs.
I don't have a spacer. Can I get one from you?
Yes, we can provide you with a spacer. Make sure you carefully follow the instructions on the inhaler and spacer.
Mihira, is there anything else I should be aware of?
If you experience any side effects, such as mouth sores or a cough, let your doctor know. Also, avoid using other inhalers or medications without consulting your doctor.
Now look at question 27. You hear a nurse called Mihira talking to another nurse. Now read the question.
Nurse Lewis, I'm coordinating Mr. Peter's discharge. We need to ensure he's ready to go home and has all the necessary information and support.
That's great news, Mihira. What are his discharge instructions?
He'll need to follow up with his doctor for a post-operative appointment. We should also provide him with information on wound care and medication management.
Has he been cleared for driving?
He should avoid driving for at least a few days, as his reflexes might be affected by the anesthesia.
What about his medications? Should we provide him with a prescription for any follow-up medications?
Yes, we'll need to provide him with a prescription for any necessary medications and ensure he understands how to take them correctly.
Is there anything else we need to address before his discharge, Mihira?
We should review his home care plan and ensure he has adequate support at home. We might need to coordinate with a home health aide or family members to provide assistance if needed.
Now look at question 28. You hear a doctor called Mihira conducting a morning meeting. Now read the question.
Good morning, team. Today, I want to remind everyone of the importance of adhering to our policies and procedures. This includes following infection control guidelines, maintaining patient confidentiality, and complying with regulatory requirements. By following these guidelines, we can ensure the safety and well-being of our patients and colleagues alongside standardized care. I also want to discuss the importance of maintaining a positive and supportive work environment. We all play a crucial role in creating a culture of respect, collaboration, and teamwork. Remember, our patients are vulnerable and rely on us for their care. It's essential that we provide a compassionate and empathetic atmosphere. Lastly, let's prioritize continuous learning and development. We should always be striving to improve our skills and knowledge. Take advantage of opportunities for training and education to stay up to date with the latest advancements in healthcare.
Now look at question 29. You hear a trainee nurse called Mihira talking to head nurse. Now read the question.
Nurse manager, I'm a bit nervous about handling babies for vaccinations. I'm not sure if I'm doing it correctly.
It's understandable to feel nervous, especially when dealing with young children. Remember Mihira, practice makes perfect.
What are some tips for handling babies gently and safely?
First, ensure the baby is calm and comfortable. Talk softly to them and offer a pacifier if needed. Support their head and neck firmly while holding them in a way that makes them feel secure.
I'm worried about accidentally hurting the baby.
It's important to be gentle, but don't be afraid to hold the baby firmly. A gentle touch can help the baby feel safe and secure.
What if the baby starts to cry or struggle?
Mihira, try to remain calm and reassuring. If the baby is crying, talk softly to them and offer a pacifier. You can also gently stroke their back or head to help them feel soothed.
Now look at question 30. You hear a physiotherapist called Mihira talking to a carer. Now read the question.
Mr. Paul, I'm pleased to see Mr. Harrison's progress. His range of motion has improved significantly.
Thank you, Mihira. We've been working hard on his exercises at home.
I'm impressed with his dedication. Let's continue with the exercises we've been doing and incorporate some new ones to challenge his muscles.
Great. He's ready to push himself.
Remember to listen to your body and avoid overexerting yourself. It's important to balance exercise with rest.
I'll be careful. I don't want to set him back.
That's important. We'll gradually increase the intensity of the exercises as he improves. Are you experiencing any pain or discomfort during the exercises?
A little soreness, but it's manageable, Mihira.
That's normal. As his muscles get stronger, the soreness should subside. If the pain becomes severe or persistent, let me know.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a physiotherapy, Mihira, and an interviewer.
Mihira, it's a pleasure to have you here today. Recently, there's been growing interest in the connection between physiotherapy and mental health. Could you tell us what initially led you to study the impact of physiotherapy on mental health?
Thank you for having me. The idea to study the intersection of physiotherapy and mental health came from a series of observations during my practice. Over the years, I noticed that many patients who came in for physical rehabilitation, particularly those recovering from surgeries or injuries, often experienced emotional and psychological challenges as well. Some showed signs of depression, anxiety, or a lack of motivation. Initially, we focused solely on their physical recovery, but it became apparent that unless we addressed their mental state, their physical recovery was often slower or incomplete. The connection between physical health and mental health is well documented, but in physiotherapy, this is often overlooked. So, I began studying this area to understand how we can help patients beyond their physical injuries and also support their emotional and mental well-being.
That's really fascinating. When you embarked on this study, Mihira, what were some of the key findings regarding how physiotherapy impacts mental health?
One of the most striking findings was the bidirectional relationship between physical rehabilitation and mental health. What we discovered was that improvements in physical mobility and function didn't just improve a patient's mood and sense of well-being, but it also significantly reduced symptoms of anxiety and depression in many cases. In our study, we measured psychological health indicators like mood, stress levels, and emotional resilience alongside physical recovery markers. We found that as patients regained physical strength and mobility, their mental health improved in tandem, often leading to a faster overall recovery than expected. This was particularly evident in patients who had suffered traumatic injuries or were recovering from surgeries that had impacted their independence. Moreover, patients reported a greater sense of control over their lives, which contributed to a positive mental state.
That's quite interesting, especially in terms of this mutual relationship between physical and mental health. Mihira, what, in your opinion, could be the reason for such an enhancement in mental well-being as physical recovery takes place?
The enhancement of mental well-being during physiotherapy is likely due to several intertwined factors. On a psychological level, when patients regain their physical abilities, it restores a sense of autonomy. Feeling capable again can shift their perspective from one of dependence and vulnerability to strength and independence. The act of physically engaging with their own recovery fosters a sense of achievement. Then, there's the biological aspect. Physical exercise, which is a core part of physiotherapy, is known to release endorphins, hormones that naturally alleviate pain and elevate mood. This is a well-known effect that has been studied in various contexts, but it's especially relevant in physiotherapy when patients are dealing with pain and mobility limitations. There's also a social factor. Patients often build rapport with their physiotherapists, which helps reduce feelings of isolation. This emotional support, combined with a growing sense of physical capability, can significantly boost mental health.
You've just mentioned some important biological, psychological, and social factors. Mihira, do you believe there's a specific game changer in this dynamic between physiotherapy and mental health that could make a larger impact?
Absolutely. While there are several contributing elements, the real game changer, I believe, is the holistic approach that physiotherapy offers. When physiotherapy shifts its focus from just physical rehabilitation to a more holistic practice, where mental, emotional, and even social health are considered equally important, the outcomes are transformative. Many physiotherapists are now incorporating mindfulness, stress reduction techniques, and mental health check-ins as part of their treatment plans. This holistic approach has been a pivotal shift in the field. The game changer is the recognition that the mind and body cannot be separated when it comes to recovery. By addressing both, we see a reduction in relapses, faster recovery times, and, importantly, patients who are more motivated to stay engaged in their rehabilitation programs. When people feel better mentally, they are more committed physically. This, to me, is the most significant shift in how we can enhance outcomes for patients.
That sounds revolutionary. How do you think this approach can be further developed within the healthcare system, Mihira?
Development of this approach requires an integrated effort across the healthcare system. First, there needs to be more education and awareness among healthcare professionals about the connection between mental and physical health, especially in the context of rehabilitation. Incorporating mental health screenings and psychological support into physiotherapy training programs would be a major step. Moreover, multidisciplinary collaboration is crucial. Physiotherapists, psychologists, occupational therapists, and physicians should work more closely together to design comprehensive treatment plans. Technology can also play a role here. We are seeing more digital platforms and telehealth services where patients can receive both physical and psychological support remotely. Developing platforms that allow physiotherapists to monitor not only the physical progress of their patients, but also their mental well-being could push this approach further. Lastly, research and funding for studies that investigate this holistic approach can validate its efficacy and encourage broader adoption.
It's inspiring to hear how this can evolve. Lastly, Mihira, what role do you think family members and healthcare workers play in supporting both the physical and mental recovery of patients?
Family members and healthcare workers are absolutely essential in this process. For one, family support can provide emotional encouragement that strengthens a patient's resolve to continue their rehabilitation. Families can also assist in creating a positive environment at home that supports both physical and mental health. Simple things like being involved in the patient's exercises or offering emotional comfort when frustrations arise can make a big difference. As for healthcare workers, they need to adopt a patient-centered approach that considers both mental and physical health. Nurses, doctors, and caregivers should be trained to recognize signs of mental distress in patients undergoing physiotherapy. They should work in tandem with physiotherapists to ensure that mental health support is readily available when needed. It's a team effort. Physical rehabilitation is never done in isolation, and the more integrated the support system, the better the patient outcomes.
Now look at Extract 2. Questions 37 to 42. You hear a dietitian, Richard Ray, on the eating habits of health professionals. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. It is a great pleasure to present this pivotal research conducted at Mihira Healthcare Institute, known as Mihira Care, which sought to examine the eating habits of healthcare professionals working in our esteemed institution. This initiative was launched with the aim of not only understanding the dietary patterns of our health workers, but also creating a sustainable improvement in their overall well-being. As healthcare providers, we are often the first line of defense for the health of the public. Yet, ironically, we sometimes overlook our own health. The initiative aimed to address this contradiction by diving deeply into the nutritional behaviors and challenges faced by our healthcare workforce. Through this research, Mihira Care has taken a major step toward enhancing the wellness of its health professionals, ensuring that they are both physically and mentally equipped to provide optimal care. The study conducted by Mihira Care involved an extensive review of the dietary habits of healthcare professionals at different levels of practice. Over a period of 6 months, a team of dietitians and healthcare specialists collected data through surveys, interviews, and observational studies. The initiative focused on identifying trends, habits, and potential health risks associated with the eating behaviors of health workers, ranging from nurses and doctors to support staff. The driving force behind this project was the acknowledgement that healthcare professionals often face unique pressures, long hours, high stress, and irregular schedules, which can lead to poor nutritional choices. While their training emphasizes the importance of balanced nutrition for their patients, their own adherence to these principles can sometimes falter. The Mihira Care Initiative, therefore, sought to highlight these inconsistencies and work toward practical solutions. The implications of poor eating habits among healthcare workers extend beyond their personal health. Healthcare professionals with suboptimal nutrition are at a higher risk of burnout, fatigue, and cognitive decline, all of which can affect patient care. For instance, a doctor who skips meals or consumes unhealthy snacks due to time constraints may experience fluctuating energy levels, making it difficult to maintain focus during critical procedures. Similarly, nurses who rely on caffeine and sugary snacks for quick energy boosts may face challenges in regulating their weight or managing stress in the long run. At Mihira Care, we believe that a healthy workforce is a cornerstone of a thriving healthcare system. By addressing the dietary habits of healthcare professionals, we aim to reduce the negative consequences associated with poor nutrition, such as decreased job performance, increased absenteeism, and even chronic health conditions like hypertension or obesity. This initiative emphasizes the need for healthcare workers to prioritize their health as much as they do their patients, recognizing that good nutrition is essential for both short-term and long-term well-being. One of the major findings of the Mihira Care study was the pervasive issue of convenience over nutrition. Healthcare professionals often resort to fast food, vending machines, or processed snacks simply because they are quick and accessible. Time pressures were another key issue, with many workers skipping meals entirely during long shifts or engaging in mindless eating while charting or attending to other administrative tasks. In addition, many health workers admitted that they lacked the energy or time to prepare nutritious meals at home, leading to a dependence on prepackaged, high-calorie foods. The irregular hours and shift work also disrupted their eating patterns, making it difficult to maintain a balanced diet. These behaviors, combined with stress, led to unhealthy cycles of overeating, undereating, and poor food choices. The solution proposed by the Mihira Care Initiative centers on education, access, and organizational support. First, educational workshops and training sessions on nutrition tailored to the healthcare work environment were designed. These programs not only educate healthcare workers on the importance of balanced nutrition, but also provide practical advice on how to integrate healthy eating into their busy schedules. Access is another major component of the solution. To combat the convenience issue, Mihira Care has partnered with local vendors and food services to ensure that healthy meal options are available in hospital cafeterias and break rooms. Vending machines now offer healthier alternatives to sugary snacks and sodas, while grab-and-go meal stations provide balanced, nutritious options that can be consumed quickly between shifts. Organizational support is essential for long-term success. Mihira Care has introduced policies that encourage meal breaks and discourage skipping meals, ensuring that health professionals are not only permitted but encouraged to take time out of their day for proper nutrition. Implementing these changes requires a concerted effort at both the individual and institutional levels. First, healthcare workers themselves must commit to adopting healthier eating habits, which can be facilitated through ongoing support from dietitians and wellness coaches within Mihira Care. By providing continuous feedback and personalized meal plans, we can ensure that these changes are sustainable in the long run. At an institutional level, the management at Mihira Care is taking steps to create a culture of wellness that prioritizes the health of its workers. This includes promoting regular breaks, ensuring that healthy meals are available on-site, and incorporating wellness into the broader professional culture. These changes are not just about offering healthier food options, but about reshaping the way healthcare workers think about their own health. The implementation of these changes will occur in several stages. The first stage involves data dissemination and awareness. Health professionals must be made aware of the findings from the Mihira Care study and how it affects them personally. Following this, the second stage will involve training and education, with workshops and courses designed to teach healthcare workers about the impact of nutrition on their professional performance and overall health. The third stage focuses on structural changes, ensuring that healthy food options are available and that policies are in place to support good nutrition. The fourth stage emphasizes continuous monitoring and feedback. Regular check-ins with healthcare workers will allow Mihira Care to adjust the program as needed, ensuring that the changes remain effective and relevant.
That is the end of your OET listening test. Now check the answers.